So the most important test for the integrity of the hip socket, and the hip socket, of course, is where the femur meets the acetabulum, is what's called the Patrick's test or Patrick-Fabere test. You place the ankle just above the knee, and on the high side, that's a positive test. That's positive for hip arthritis, for hip capsulitis, for just mechanical dysfunction of the hip. That's the most impressive test. And a very negative test is when you do the same thing, and of course, it's very loose. So that's a negative test. So what we're going to do now is we're going to stretch this into flexion. So we lift the leg up, and we push it gently, and every 10 to 12 seconds, this is going to release. You almost don't even have to use innate mobilization for this, because every 10 to 12 seconds, there's something called ligament creep, and the ligament just releases. So you wait every 10 to 12 seconds, and you'll feel a release. And this is part of the exercise program as well. And that's how you mobilize the hip socket. So when mobilizing the hip socket into extension, you grab the leg just on the inside of the knee, and then you put your other hand over the greater trochanter, and that's your fulcrum. And you take the hip into extension, and you take it to its maximal point. If you want to, you can use innate mobilization. And I can say, for example, move your leg toward me. That's good. And then relax. And then we wait about 10 to 12 seconds for the ligament to stretch. And once we feel a little bit of stretch, I say again, move your leg toward me. And that is mobilization in both flexion and extension.